There is still time to get help signing up for an affordable insurance plan through the City of Jacksonville's Get Covered Jax campaign. Yesterday, we hosted a phone bank right here where experts answered questions about enrolling in certain insurance plans. About 120,000 people under the age of 65 are currently uninsured in Duval County. From now until January 15th, eligible people can enroll in a private health care plan through the Florida Health Insurance Marketplace. Meanwhile, the past 30 years have shown that with the support and generosity of volunteer medical physicians, we can make an impact. Last year, Care Jax was able to provide access to health care for over 1,800 patients. And next week, you have a chance to help honor our local health care heroes. We really appreciate them, all their hard work day in and day out. So joining us this morning to talk about the Caring Awards, Angela Strain, Executive Director of Care Jax, and Dr. Scott Ackerman, the Medical Director of the Ackerman Cancer Center. Good morning to you both.
Good morning.
Angela, Care Jax really is filling in the gaps for people that need that help. Can you explain what you do in the community?
Absolutely. So you just mentioned that we have 120,000 neighbors without health insurance. For about half of those, they're also living in poverty. So accessing health care can be a challenge when you're worried about how do you pay the rent and how do you keep food on the table. So for 30 years, volunteers like Dr. Scott Ackerman have stepped in for specialty medical care that they offer as volunteers at no cost to the patient or their families. And when you're looking at a diagnosis like cancer, that makes all the difference. They are saving lives by volunteering in this gap.
And there's no bills.
And there's no bills.
Wow, that's incredible. Even for people that have insurance, the bills can pile up. Dr. Ackerman, congratulations on being honored as one of the heroes here.
Thank you, Vic.
Tell me why you do it. What's so important about being able to help people without making them pay for your services?
It's very important to me to give back to the community. I've been involved with WeCare since its inception in 1993. And WeCare takes care of patients that are uninsured and unable to get insured for the most part. And it's just important to me. I'm very grateful for the successful practice that we have. I'm very grateful for the gifts that we've received, and I like to give back, and I give back in many ways. And I think being involved with WeCare and helping those patients that are less fortunate to have access care, not just cancer care that I can provide them, but my volunteer work with WeCare also helps patients get access to other specialty care because of my friends and connections around within the medical community, and it's very, very rewarding for me.
So you said that it is rewarding, and I know that you've treated a lot of patients through WeCare. Are there any stories that really stick out to you as far as, wow, I made a difference here?
Yeah, well, there's stories, stories all the time. I see a number of patients every year, and these are people who are immigrants that have been having problems for quite some time. A woman with a mass in her breast that was unable to get any sort of care, couldn't even get a biopsy anywhere, and we were able to take care of her through WeCare, and her life is saved because of volunteers, not just myself, but other medical volunteers throughout the community that are helping these patients who otherwise would fall through the cracks and die of metastatic cancer.
It takes a village. Angela, if people are inspired by this story, by this segment, how do they get involved? How do they make a difference with Care Jax, whether they're medical or not?
Well, we have a huge patient-centric approach to our care. So it's the medical access, which of course is the doctors in our community. We love them to volunteer. We also do wraparound support. We want to make sure that as a patient is going through cancer treatment, they have all the supplies and food and home support they need. So volunteers can come and help deliver fresh produce. They can help us pack pantry items. Go to our website, wecarejacksonville.org, and we can get you connected.
WeCareJax.org, right there on the bottom of your screen. We're going to post it on our website. Thank you for what you and your team do in the community. Dr. Ackerman, thank you. Listen, my mom and dad have known you for a very long time, and they always say he is so generous, he is so kind, he treats so many people, even if they don't have the insurance. I just want to give you that compliment as we end this segment, and we're going to post this online if you want more information. Ash?